Well, I am joined now by Assistant Professor Ratimira Lazić, the Deputy Medical Director of the University Eye Hospital in Svjetlost. Welcome.
Hello.
I'm very pleased to have you with us.
Thank you.
Now, I noted earlier from the EBA brochure that you deliver an extensive range of services across the region. How would you describe your main role? What is your main business?
Well, our main business is to provide a comprehensive eye care to the patients from the region. That means Croatia, Slovenia, Bosnia and Herzegovina, Serbia, Montenegro, Italy, Hungary, so we would like to expand. So our main goal is to provide the comprehensive and full eye care of our patients. That means the total care of the eye diseases and the eye services that can be provided at present in the world. That means that our business is to give the top quality to our patients with the newest and the top equipment that is now present in the world.
Wow, that seems a major medical undertaking. How many people do you employ?
Well, we are already the largest private eye clinic associated with a university in that part of the world. So currently we have 40 eye doctors, that means 40 eye specialists, and currently we employ like 150 doctors and medical staff, and we have 4 hospitals, 4 buildings. 2 in Croatia and 2 in neighboring Bosnia and Herzegovina. We also have some associate offices in Montenegro, in Slovenia, in Serbia and in Macedonia.
Okay, so you cover a vast area.
Yes, we cover a vast area, and also, as you know from the map, Croatia is really strategically located in the central Europe, like Central South Europe, which means that it's very easily reached by plane from all European countries. For example, it takes you like an hour and 45 minutes to fly from London directly to Zagreb. It's like 1 hour and 30 minutes from Paris. Or if you want to take a ride by your car, you can reach Zagreb, which is the capital of Croatia, by 3 hours by car.
Wow. So it's quite an extensive business. What about your business makes you most proud?
Well, we are most proud because we have 20 years of experience and we've already become an established brand. That means that, although you need to tell the people that you are there and invest in marketing, our patients, satisfied patients, and we performed more than 100,000 eye surgeries, are actually our best ambassadors. So what makes us very proud is when we get new patients and they say that they've been referred to us by their friends or colleagues or relatives that were very satisfied with the services that we provide. So that really makes us most proud.
So you have a very established, well-known brand.
Yes.
That is promoted by your clients.
Actually, you are completely right, because we cover all eye services. For example, we are very recognizable by LASIK or refractive surgery, which means that we've started this business in 1998, when Professor Gabrić, who is our founder and CEO, performed the first refractive LASIK surgery in that area of the world. So we have a great number of people that we performed refractive surgery. Then we have a huge number of patients that we treated for the cataract disease. Then we also cover the retina disease, and the diabetes is damaging eyes. Then age-related macular degeneration is a very prevalent disease today, and we actually administer the most recent drugs. We also participate in clinical trials that actually investigate new pending drugs to be approved. We also operate on children. We transplant corneas. So as you can see, we have a lot of ambassadors, and maybe some people actually were treated for one disease, but they were so satisfied, and they know that they can recommend to their family members or friends that they can refer to our clinic for some other disease to be treated.
So you've come a long way since the University Eye Hospital started, and you cover a huge area. How do you think you can expand even further, and how can you possibly expand into new markets? What are your dreams for the future?
Well, you know, we invest a lot in education of our people and our staff, and the expertise of our doctors and the equipment. The thing is that we can provide really a top service that is as on a standard of service as would, for example, be in the United Kingdom or maybe Germany or United States. But unfortunately, there is some prejudice toward that part of the world. As you know, there were some unfortunate events from the 1990s, and you know, people still have memories of those events, and they don't know much about the quality of the service that is provided in Croatia. So we would like to expand to the Western market as well, because as the price of the labor is somewhat lower than, for example, United Kingdom or in Germany, we can offer more competitive prices, and the standard of service would be great. For example, the NHS pays like £2,000 for cataract surgery for their patients on the waiting lists to be operated in Germany or in Netherlands. Yes. If those patients were to come to Croatia, they would pay, NHS would need to pay only £1,000 for the cataract surgery, and you know, they could reduce the waiting lists, and also the people could have a nice holiday in Croatia.
Because the people who come with the patients can enjoy a holiday.
And also the patients themselves, because you know, it's a one-day surgery, and after you're operated, actually you need to stay there for your checkup, and while you are there you can go around and just relax on the beautiful Adriatic Sea.
So it's very good value, but the surgeries are still performed by top-level surgeons. Yes. At well-appointed and equipped facilities.
Yes, because you know, we had to adjust our prices to the standard of the people from the region, and of course we are not going to have double standards offering a higher price for the people that come from the other countries. So the price is the same for domestic or foreign people coming, and of course the price of the labor is also a little bit lower, and you know, the cost of the expenditure is also adjusted by the big companies for our region. So that's why we can offer a more competitive price. But the thing where we do not make a compromise is the quality and the education of our staff. Because you know, if you have one unsatisfied patient, you can have like 1,000 satisfied, and you know, this one that makes more damage.
Everybody will listen to the one.
Yeah, you're right.
Absolutely. Well, people's eyesight is so important to them, so I'm very grateful for all of the good work you are doing, and thank you very much for talking to us today. Thank you very much indeed.
Thank you.